And welcome to this week's edition of ACAP Today for the week of December 14th, 2020. I'm Jason Parent with the Aroostook County Action Program. On this week's program, a continuing of our Maine Leaders Conversation series. This week, we're going to talk with a very special guest, and that's Dr. Nirav Shah from the Maine CDC. Many of us have become familiar with Dr. Shah over the past several months of the pandemic. He's sort of become a bit of a rock star here in Maine, and we're looking forward to having a conversation with him about the spike in the pandemic, the rising number of cases in Aroostook County, and also ask him the questions that we've been asking our other Maine leaders, which includes what his thoughts are on 2020, very interesting conversation, as well as what his priorities for 2021 will be, as well as what he's resolving to do for the new year. But before we get to Dr. Shah, in this week's Maine Leaders Conversation series, we want to first begin with our news and information that you can use, news and information that's helpful to our community as we get through the pandemic and these challenging times. And we begin by letting you know again that our offices have been closed to the public as a result of the spike and surge in cases in Aroostook County. It is a very difficult decision. We are continuing to do window service and curbside service at our Military Street in Holton and our Presque Isle 771 Main Street facilities. Both of the facilities have been equipped with a banner, such as the one that you see in the photo here, where you can call for service and we will be able to connect directly with you and make a determination whether we're going to serve you through the window or meet you outside. Please do, if you come to those buildings, as well as our Fort Kent building, we have a video doorbell that's available as well, so you can connect with staff inside the facility that way. Our early care and education facilities are basically on a classroom by classroom basis at this point, as we have potential close exposures and things of that nature. We are making decisions on classrooms individually, as well as centers as a whole. We really encourage you to call ahead to a center if you would like to know what the status of that early care and education center is in terms of what classrooms are running children. However, that said, we are proactively reaching out to parents of any involved children in any of the classrooms where the status has changed, and we will certainly reach out to our parents in that regard. So thank you for your patience with us, and we of course continue to offer services remotely as we can. We also are offering to our community and have a new shipment of masks that's on its way to support our community with free cloth masks that are available to people who in our community who need them. We are distributing those through our Presque Isle facility near Walmart and Tim Hortons, our Holton facility on Military Street, and our Fort Kent facility in the Industrial Park. If for any reason you are in need of a mask, we encourage you to reach out to one of those offices, and we will make arrangements to get those out to you, outside to you, or we can even mail them if you would like. Please do give us a call, 764-3721, and we can make arrangements to get masks to you. This, of course, masks are more necessary than ever, not only to stop the spread of COVID-19, but also to comply with the executive order issued by the governor on December 11th, which really requires them for entry into any facility. So we want to be able to be helpful to you with that. Speaking of being helpful to you, we want to also offer our Navigator Services. These are set up through our CARES Act funding and are designed to help individuals and families and households who are struggling at this time with connecting them with the appropriate services, whether those are ACAP services or services outside of our agency. We would be happy to do that. Please contact our Navigator program at 764-3721 if we can be of any assistance to you at this time. Even if you don't know what that assistance might be, we'd be happy to help you navigate those needs. Our 2020 community ACAP community assessment is available for the public. It's now available on our website to be downloaded electronically. You can also call us at 764-3721 if you'd like to receive a paper copy in the mail. We have a limited number of those copies available. This looks at specific causes and conditions and challenges around the subject of poverty, as well as health conditions in our community, and we encourage you to check it out. Has a lot of great information in it, and it's an update of our 2017 community assessment as well. Our 2020 Impact Report and Directory of Services are also available for the public. They are available online as well. You can also receive these materials through the mail by contacting Sherry at 554-4103, and we'd be happy to get them out to you. We have mailed them out to all municipalities at this point, and they should be available as well at your local town office. if you'd like to check them out. Our COVID-19 rental relief program, which has been extended through the month of December, covers the months currently of October, November, and December. If you would like an application, please go to mainhousing.org/COVID-rent. That's the best way to get into the queue. We do have a lot of applicants that are waiting to have their applications processed. We do ask for your patience. We're starting to get through the bulk of the December rental assistance request right now. At this point, we only have confirmation that the program is going to run through the end of December. It's been funded through the end of December, and we hope to have more information for you as time goes on as to whether that will extend into the new year as well. We also are very pleased to be through our drug-free Aroustic program in partnership with other partners, including the University of New England and others. We'll be offering an online screening. This is tomorrow, Tuesday, December 15th at 6:30 p.m. The film is called Angst. It's about raising awareness around anxiety. We understand that there's a lot of that for teenagers on a regular basis, but certainly as the pandemic is here, it's caused a lot more challenges for families. We certainly have this opportunity available. You can visit our website for more information on this. We're also posting information on Facebook about this. Our Facebook site might be the best place to go to get information. Our Facebook page may be the best place to get your information on this. It will be a live screening followed by a panel discussion to answer your questions about anxiety in youth. If you can't make it on the 15th, there's going to be an on-demand recording of the screening and the panel discussion that will be able to be viewed in the days following on the 17th and 18th. This is a great opportunity for schools, youth organizations, and families. If you have more information, Sherry Sullivan, who's the program coordinator at Project Alliance there at csullivan29@une.edu is the best contact, but you can also contact Meg Hegman here with Drug Free Aroustic program. It's a 55-minute video and it's appropriate for ages 10 and up. It might be very helpful to your teenagers in the household and you as parents to better understand all of the emotions that teens are going through, especially as the pandemic is here and is impacting that even more so than it otherwise would. The Home Energy Assistance Program is also continuing to take appointments for this season. They are offering all of those appointments remotely by the phone. We encourage you to contact us. There have been new program guidelines, as we've been sharing on several ACAP Today broadcasts that have been instituted that would allow for, we think, thousands more households to qualify for this program. We are booking appointments into the new year at this point, but we encourage you to do that, as any benefit you receive would remain on your account for 18 months or until it is expended. That's on your fuel vendor account. Give us a call, 764-3721. We'd love to get you connected with a HEAP appointment in the new year. We also are offering the opportunity for area organizations, businesses, civic groups to contact us about their tobacco policy. We offer a free service with a Workplace Smoking Act in relation to the Workplace Smoking Act that helps workplaces develop a tobacco policy. In addition to that, we also provide free signage, such as what you're seeing here, as well as education for you, the owners of the business or enterprise, and your employees. All of that can be offered and is offered at free of charge. Chastity Holland at cholland@acap-me.org is the person you want to get in touch with. We also offer a tobacco cessation program, and as the new year is just around the corner, many people are considering quitting smoking their New Year's resolution. If that is the case, or if you're even considering it, contact Elaine Sipe at 227-2348 or esipe@acap-me.org. She can connect you with free things such as quit kits, provide you with virtual meetings, help you make a quit date plan. So if January 1st is the date you'd like to target, she can help you with that. And she can connect you to free nicotine replacement therapies all through this tobacco cessation program. Again, contact Elaine Sipe for more information. Maine's Workforce Collaborative, which includes ACAP, as well as Workforce Solutions operated by Goodwill Northern New England and Eastern Maine Development Corporation, our partners, are offering several topics. We've been talking about these for a number of weeks. several educational topics and sessions online. They include Maine's Employment and Training Program, the Interviewing Tips and Tricks session, Making Career Choices, Resume and Cover Letter Development, and Preparing for a Job and preparing how to retain that job or that employment. If you would like more information on these, they continue into the new year. Please give us a call and connect with Kathy Williams, and she will help you get connected online with these courses. We also are offering a number of positions across Aroostook County and inviting folks to consider joining our organization, from a bus monitor position up in Fort Kent to ed tech positions in Caribou and Presque Isle, and a community educator working out of our Holton office. All of those position openings are available at acap-me.org. Check it out. We'd love to have you join our ACAP team and hope that you can. And we also want to let you know that and congratulate two of our ACAP team members who have received national certification for the ROMA program, which is Results-Oriented Management and Accountability, part of our Community Services block grant here at ACAP. And congratulations to Jamie Chandler, our Chief Operating Officer, and Amy Murchison, one of our program coordinators, on obtaining this certification. We're proud of you both and appreciate the work you're doing. We also want to remind our community about our ongoing community closet project that initially was something that we just did prior to this time of year, but the community closet continues both with clothing and jackets outside of our facility, coats and clothing. It's outside of our 771 Main Street facility, all the way to the left. If as you're looking at the door, there's been a little built-in area there to help people get out of the elements, but it's open 24/7. You can drop off clothing 24/7. You can also pick up clothing 24/7, and we encourage you, if you are in need or if you have clothing to donate, to take advantage of our community closet. And we want to say a special thank you to several county grocers, as well as Aroustic Foods, who have provided us with cereal to help stock our community cupboard, which is outdoors near the community closet here in Presque Isle, but also to help us get cereal out to families in our early care and education programs. We thank Parity Shop and Save, Graves Shop and Save, who have both joined this, as well as the Caribou Hannaford, who have all provided us with cereal, which is a great thing to be able to put out in the community cupboards this time of year, as it does not freeze. And we want to thank our Shannon Hill, who is our project lead. This is in lieu of the St. Apollonia Dental Clinic Festival of Trees, so that we can still have the cereal to get out to families in need through our community cupboard network here in Aroostook County. So we thank those grocers and Aroustic Foods for their contribution and donation to this cause. And finally, I mentioned the community cupboard. The cereal is destined for the community cupboard, and we want to say a special thank you to the United Way of Aroostook for their sponsorship through the month of December of ACAP's community cupboard, which you're seeing a picture of here, again, located just outside of our Main Street facility in Presque Isle. And there's a network of them in different communities. There's one recently that went up in Madawaska, and another one that went up outside the Bread of Life Soup Kitchen in partnership with ACAP and the United Way of Aroostook and Caribou just this past week. So we thank the United Way of Aroostook and all of our sponsors and supporters for their help with the community cupboard. Concept is simple: give what you can, take what you need. And that's this week's news and information that you can use. And as we noted at the top of this week's webisode, we are pleased to be joined in the Maine Leaders Conversation feature interview on today's version of ACAP Today, Dr. Nirav Shah. Thank you so much for joining us today, Dr. Shah.
Hey, good morning, Jason. Thanks for having me on.
So busy time for you. And this week has just been an incredible week. I think you kind of warned us all about it. It's sort of the peak that we're hitting, the COVID winter, if you will. Before we get into that, I want to know about your thoughts about the year that's almost past now, 2020. What an incredible year for you.
Well, what an incredible year for all of us. I mean, let's just acknowledge right at the top that everybody this time last year who was talking about where they thought their year in 2020 was going to go and what they thought their resolutions and priorities and where they saw themselves in 2020, let's just all acknowledge that we all got that completely wrong. It has been a year for the history books. And when I look back on it and look forward into next year, there are a few things that I'm thinking about right now. The first is First of all, just how thankful I am to be in a state with the team here at the Maine CDC that has been working day and night, 24 hours a day, 7 days a week, to try to get a lid on where things stand. I have a lot of thanks and appreciation for the entire team at Maine CDC. I also have a lot of thanks and appreciation for everyone in Maine too. My wife and I, my family and I moved here about 1.5 years ago now. And never did we expect for there to be a pandemic like this, but B, alongside that, we never could have expected or predicted the incredibly warm and welcoming reception that we have received from everybody in Maine. So we are really thankful to be here.
And the fact that you can say that in a pandemic is quite incredible. Just wait till we get post the pandemic, you'll really feel the true warmth of Mainers, Dr. Shah. But we're glad to hear that, and we're very, very glad to have you in our state. Speaking of priorities, you noted that 2020, we set resolutions and the like, and we never could have imagined what the year would be like. How do you set priorities going into 2021, knowing that I think we're very hopeful that the vaccine is going to help ameliorate the situation, but we've got a ways to go, don't we?
We do. The vaccine, it could be arriving in our state in just a matter of days, perhaps by mid-December. We may start seeing doses of vaccine coming into our state. That's encouraging if it happens on that timetable. Unfortunately, the bad news is that the arrival of a vaccine will not necessarily or automatically spell the end of the pandemic. That process of moving COVID out of our state may take many, many more months. As I think about our priorities into 2021, clearly one of them is vaccinating everyone across Maine. My goals are twin goals. One is to vaccinate as quickly as possible. The other is to vaccinate as equitably as possible. So let me give you a concrete example of the equity piece. Hopefully, the first set of doses of vaccine that come to Maine will be coming in about 6 shipments. And I wanted to make sure that we were ensuring geographic equity. And so as we were looking at where to place those first doses, we deliberately chose a location in Aroostook County to make sure that everywhere across Maine started off on a good footing with respect to the vaccine. So we made sure that we tried to have that geographic equity as a component of our planning process. So one of our chief goals in 2021 is to try to move vaccine out of the warehouses and into people's arms as quickly as possible. Another goal, though, is I think we all have to remember the significant toll that the pandemic has taken, both from a physical health perspective, because other healthcare may have been avoided during this time, but also from an important psychological and mental health perspective. And so one of my goals for 2021 is getting folks back to where they were in 2019, trying to help restart that semblance of community that you mentioned a moment ago, Jason, and getting folks back to a baseline level of good health through exercise and getting their screenings done, things like that. That's another big goal of ours for 2021.
How do we do that, Dr. Shah, as we get back into sort of society in a vaccinated world? Are there things that have to change that won't be the same as they were in 2019?
Some things will go back ideally to the way they were before. But other things that we have all been accustomed to living with will probably persist for a while, either because of the demands of the virus or because of human nature. I don't know about you, Jason, but I'll tell you, even when I'm talking to my family, as much as I love live music, it's going to take some psychological, it's going to take a little bit of getting over a hurdle for I think all of us to get used to being in crowds again, in large gatherings and things like that. So that's going to take time. I think what will change the most as we reemerge from the pandemic into a vaccinated world, as you said, I think what's going to change the most is the way that we reconnect with each other. Getting away from Zoom, as wonderful as it has been, and moving back into in-person meetings, for example. I think that's going to be a change that's going to take all of us a little bit of time to adjust to. I know it will for me.
The effort here in Northern Maine, this is a great opportunity for you to connect directly with the folks of Northern Maine. When the pandemic first hit, Aroostook County had relatively few cases. We were doing all the precautions. We had shut facilities down and the like. And now I think we're seeing our surge. I think you'd agree with that. And we're not. Things aren't shutting down. Is it a combination of some of the rancor that happened around the last time we shut down and the concern around the state's economy, or is there some new information that has been helpful to us in terms of the science around the vaccine, around the virus, so that we're not going back to those standards? I think I've had a number of staff and people in the community say, gosh, what we did last March, we should be doing now, because it's gone from being down the road to in our living rooms.
We hear that. I get a lot of emails and folks who are saying, gosh, why don't we shut down again? And that's an option that's on the table. Maybe it will resemble what we did in March, but maybe it doesn't have to. And no decisions have been made with respect to that, but it remains an option on the table. As you can imagine, Jason, it's an option that comes at significant psychological, mental, and physical toll. Hospitals not necessarily being able to do preventive health screenings because of other demands that they are faced with. The approach that I think we've taken, and that a number of states have taken, is to see what other strategies we can deploy in the hope of averting a widespread type of indoor gathering restriction of that nature. And this is one reason I'm really delighted to be able to speak with everybody, because one of the things that we know now that we didn't really know so much in March, April, is the efficacy of some of the things that we talk about every day now, like masks and physical distancing. We had good reason to believe they were effective back then, but now more and more of the data have come in, and the science is really settled on the effectiveness of things like face coverings and physical distancing at bringing the virus under control. If you were to ask me, what would be the one thing that we could do right now to avert some of the closures that you referenced, it would be having folks wearing a face covering. Something as simple as that could reduce the levels of the virus appreciably and really help us avert having to close so many businesses and cause financial ruin to so many families. So that's, for me, kind of where my head is at.
Great, and I just want to take a moment to remind those who are viewing, as we noted at the beginning of the broadcast, we are offering free masks to anyone in need in Aroostook County at any of our ACAP locations. Though our facilities are closed, you just need to ring the external doorbell and we'll make sure that we get a mask out to you. So we don't want there to be any impediment to you wearing a mask, including in the inability to obtain one. We have them and we're offering them free of charge to folks here in Aroostook County. So Dr. Shah, as you look at Aroostook County, I know that you're looking at, we have a long-term care facility here in Presque Isle. It's seen a bit of an outbreak. Where are your concerned hotspots, if you will, in Northern Maine?
My concerns are in three areas. Number one is the long-term care facility, congregate living facilities that you mentioned, Jason. Those are where our most vulnerable Mainers live, and they are at risk, as well as the people who care for them and serve with them. Staff in those facilities are themselves at risk. We've seen outbreaks of COVID-19 across the state of Maine in congregate living facilities, and I'm concerned about the ones in Aroostook County in particular, because there hasn't been as much disease, and so that means there are more folks who are vulnerable. So that's one area of concern. Second area of concern that we've got is around the hospitals. The hospitals in rural parts of the country, as well as in Maine, may not have, for example, the deep staffing bench that hospitals in urban places in the state have. It's such that if a handful of staff members become sick with COVID or the flu, there may be wider closures within the hospital itself. So one reason that we wanted to focus, for example, on starting our vaccination journey among other places in Northern Maine, in the county, was to try to protect the hospitals there as much as possible so that even if a few staff members got ill, it wouldn't spell widespread closure. The third thing that I'm concerned about is because, as you noted, Jason, Aroostook County has historically not had the same number or percentage of cases as other parts in Maine. I'll be honest, I'm a little worried that folks may not see the virus in the same way that folks, say, in other parts of the country or state do. They may think it's a phenomenon that exists in urban areas or other parts of the country, but not in their neck of the woods. And Jason, what I want to talk to everyone directly about today is that where we are in the pandemic right now is that the virus is in your community. It's in your neighborhood. People around you may be carrying it. And so as we go into the winter holidays, as we go into Christmas, when families are getting together, that's what I'm worried about. And I know it's a weird thing to do, but if you can convince your family to wear a face covering, even when you're indoors across different households, that's a way to break those chains of transmission.
Great. So is the preferred method obviously non-gather?
Well, it's a balance. I'll be honest with you. The safest thing is not to gather with folks outside of your household. But, I'm going to be honest with you, Jason. There's a good way to do public health, and then there's a less good way. The less good way is just to tell people, here's what you should do, here's what you shouldn't do. And that runs into limitations. My way of doing things is to try to help people do the things that they want to do safely. And so we all want to gather for Christmas, right? I mean, I haven't seen a lot of my family and I'm going to be missing them. We all want to gather. If you feel the need to gather across households, which I understand, I feel like the best thing you can do is to try to keep it separated and wear face coverings. If you feel like your family can celebrate and congregate by FaceTime and by Zoom, then that's a way to keep everyone up. That's a way to achieve maximum safety.
Speaking of our family, we consider ourselves a bit of a family here at work. We have 170 employees across Aroostook County, and as a community action agency, we're quite diverse with 40 programs. We work in health and prevention, early care and education, energy and housing services, and workforce development, and among others. We have staff going into people's homes to do weatherization work. We have all kinds of activities that we're doing, and we're doing safely right now. But early care and education has been one area. We have our Caribou Center. We sent 11 employees home for a 10-day period because they had a close contact through a child in the center. So we're trying diligently to try to keep our centers open so that parents who are working have a place to bring their children. Do you know anywhere beyond the vulnerable population, the elderly population, healthcare workers, where childcare workers or others who are in frontline enterprises like that might be down the line in terms of the vaccine at this point, or is it too premature?
It's one of the things that we're thinking about is after we work on vaccinating healthcare providers and long-term care residents, where do we go? And according to the US CDC's expert panel, one of the places that will probably go next is those frontline or essential healthcare frontline or essential workers in general. Folks who are out there every day, like you said, Jason, who are on the front lines providing critical services. Now, we're not sure, that's a big group in Maine. It's a big group everywhere. So we're not sure where exactly in the pack, for example, childcare providers may stack up, or whether they may be in a group that comes a little bit later. But very, very certainly we are thinking now about those frontline providers who we know are so vital to keeping our economy going, keeping our families going, and most importantly for the work you guys do, keeping our communities tight and close-knit because of the social services they provide. We're not going to forget them. It's just a matter of where they come in the pack.
What do you say to folks, because there are those out there, I'm sure you've heard from them even yourself, who are very leery about the vaccine, who don't want to take it because it's so new?
I understand where those concerns come from. Usually we think about a vaccine being developed over a very long period of time, and yet here we have one that has been developed in a much shorter period of time, approximately a year. And so I understand where those concerns come from. What I would offer is that the vaccine has been tested on a high number of people, and there were side effects. Folks complained of getting a fever or having a little bit of pain in their muscles after they got the vaccine, maybe some body aches. So it's important for folks to know what those few side effects looked like. But I also think it's important to keep in mind what the risk of COVID is right now. The risk of COVID in places like Aroostook County is high and getting higher, to say nothing of other places in Maine. And so, of course, folks have legitimate questions. We are going to try to provide legitimate, respectful answers to folks. But I would also ask everyone to keep in mind what the alternative is. For many folks, the alternative will be not getting vaccinated because of those concerns. And given how high the levels of virus are and how much higher they're going, that too carries risk. So that's how unfortunately the world is right now. It's a question of balancing risks, and that's a difficult thing to do.
In your estimation of a timeline, what do you think is a reasonable amount of time, sort of date stamp, if you will, when we would be able to have every Mainer who wants to be vaccinated?
That's a question our team is trying to put a better answer to, because it depends almost entirely on how much vaccine is being produced. We at the state level are ready to have the baton handed to us so we can start running as fast as possible, and we can start vaccinating healthcare workers, nursing home residents, so on and so forth. I think practically speaking, Jason, by the time we get to folks who are healthy, who don't have other health conditions, it could be well into 2021, maybe the second, but perhaps the third quarter of 2021. So maybe June, July, August is when we may get to that point where, as you said, everyone in Maine who wants a vaccine has been able to get one. So it's going to be a long haul.
What's the percentage number that you target and say, gosh, I'd feel comfortable if we reach this percentage? Obviously, you'd love 100%. I think we all would. But what percentage level do you feel we get the sort of herd immunity effect, if you will?
So you're right, Jason. The ideal is 100%. And that's what we're going to shoot for. But from an epidemiological perspective, the number that we've really got in our head is around 75 to 80%. That's where we would start to see follow-on benefits, even for those who didn't get vaccinated or can't get vaccinated for different reasons. So, of course, we want to make the vaccine available to every single Mainer who wants it, but and that's going to continue to be our goal.
And of course, I'm sure you'll be watching regions of the state, because 95% in Portland versus 50% in Aroostook County is not going to be effective here, is it?
Right. It's got to be across the board. One of the things that we have all, I think, what I have learned, and it's been made clear to me, is that none of us is an island. We are all connected. And that's what the pandemic has really shown. We are all connected. And so, yeah, it's all well and good if folks in one town really get vaccinated, but if folks in the next town don't, we haven't really changed the ballgame that much.
Right. I want to be respectful of your time. So the last question I'm going to ask you after this next one is about your 2021 resolutions, but I did want to give you the opportunity that if you had anything else that you wanted to say to the people of Northern Maine, or information that you wanted to share to the folks of Northern Maine that I haven't asked about, this would be a great time to do that.
Well, I think, Jason, we've covered the waterfront. I do want to take a moment to send everyone, on behalf of myself and the Maine CDC, season's greetings, and I hope everyone has a good and happy and healthy Christmas season above everything else.
Wonderful. Okay, so now here's the question. We're heading into 2021, and you sort of already have your eye on how busy you're going to be in your team, your wonderful team, which we all give credit to across the state. What are you resolving in 2021?
So I'll talk about this in two ways, Jason. First is my own team's resolutions. What are our resolutions going to be at the Maine CDC? Number one, of course, to try to get vaccine out with speed and equity as much as we can. Number two, to focus on some of the things that we have to remember haven't gone by the wayside, even during the pandemic. Things like the opioid crisis haven't gone away, to say nothing of other chronic diseases like obesity and hypertension. We've got to renew our focus on those. And then the third thing I want my team to do is for themselves to look back and reflect on the job they've done. One of my goals has always been to lead our team with pride and fly our flag high. And I want my team in 2021 to look back on 2020 and say, when the situation demanded it, Maine CDC came together to serve the people of Maine. That's what I'm hoping my team does. For me personally, in 2021, one of the reasons that my wife and I were so excited to move to Maine was because of the opportunity to do the things that we do, that we love to do, which is pretty much to be outdoors. So one of the things that I am looking forward to doing in 2021 is exploring as many of the hiking trails as I can in Maine and scale as many of the mountains as our physical capabilities allow us to do. I'm looking to get back into cycling, or get into cycling, I should say, not back into it, and try to get outside as much as possible. So that's going to be a big priority for me in 2021.
Well, we have plenty of opportunities to do that in Aroostook County, and we'd love to have you and your family come visit.
It would be an honor. It would be an honor, Jason.
Well, with that, I thank you so much for your time and for speaking to the people of Northern Maine through this medium. And we do look forward to returning to a day where we can meet with folks like you in person and say thank you personally to you and your team for all that you're doing. I know it's long hours and hard work, but you've done an incredible job helping to keep Maine safe through this. So thank you so much.
Thank you, Jason. Thanks for the opportunity to chat with everybody. I look forward to hanging out with you guys in person soon.
And a special thank you to Dr. Shah for being our special guest this week on the Maine Leaders Conversation Series here on ACAP Today. We're most appreciative of the time that he dedicated to our organization to have this conversation and to getting his message out to the folks of Northern Maine. Next week, in our Maine Leaders Conversation Series, we will feature U.S. Senator Angus King, who will join us on the program. He has a lot to say about his bipartisan work on a relief package, and we'll look forward to connecting with Senator King on next week's Maine Leaders Conversation Series. Before we leave you today, we want to remind you to reach out to us, to connect with us if we can be of any assistance to you. 764-3721 is our number. You can also email us at info@acap-me.org. You can also connect with us on our beautiful new, relatively new website, acap-me.org. You can also check us out on Facebook, where our team, our development and communications team, and others are posting great stuff on a regular basis. There's also the YouTube channel where you can watch past Maine Leaders Conversation Series or past ACAP Today broadcast. And then lastly, you can check us out on Twitter if you're so inclined, as we are there now as well. And finally, we leave you today, as we do each week, with our snapshot of the week. And throughout this Maine Leaders Conversation Series, we're sharing with you some of our own ACAP leaders, those who are celebrating milestone anniversaries with the agency this particular year. And we're very pleased to spotlight this week Vicki Bolstridge, who has been with ACAP for 35 amazing years. Vicki is at our Gouldville Early Care and Education Center, and ask anyone and they'll tell you Vicki runs our Early Care and Education Center at Gouldville. She's the person we consider in charge over there, and she takes care of everyone. She is a phenomenal employee that anyone would be blessed to have, and we certainly are very blessed to have her. We asked her what her favorite memory was, having worked at ACAP over the years, and she says that there are very many memories that she recalls, but one she remembers fondly is a trip to St. Louis as a supervisor for the home-based Parent as Teachers training. She went along with three of her colleagues, Christine Condon, who is a Head Start home visitor with ACAP still today, Tanya Tebow, as well as Roxanne Stewart. They were their travel mates, and she says that they were the best, that she learned a lot in those 4 days, and they learned a lot about each other. They, of course, enjoyed some sightseeing, but had a little bit of a difficulty getting back home. They missed their flight, not their responsibility, but due to the airline, and ended up in Minnesota before getting back to good old Maine. Vicki tells us and shares with us that ACAP builds relationships with customers and especially between coworkers. She loves her ACAP family, and we love you, Vicki. So thank you very much for your 35 years of dedicated service. You are our not only snapshot of the week, our hero of the week, Vicki Bolstridge. and a hero for many families each and every day. Well, we thank Vicki and we thank all of you for joining us on this week's edition of ACAP Today. Again, we'll be back next week with Senator Angus King. We'll see you then.